So this is what Martin had to say when I recently asked him about the GIRFT programme.
As you know, I've been asked to talk about the Getting It Right First Time programme, of which I'm the clinical lead. And although I have a day job as a consultant chest physician, what's occupied my time over the last 2 to 3 years is getting it right first time. The most important part is I've now collated all of the national data and all the visits that I've done and have produced a national report looking at where we've got variation and then looking at some of the size of that variation and to see what we can do if we make a difference. And for example, we look at readmissions for asthma. If we just change the dial a little bit and reduce those admissions by 2 or 3%, then the savings we can produce are really quite substantial, and we can then reinvest those savings to deliver what we need to get to that position. So it's a way of trying to look at good practice, taking it from perhaps a financial point of view and a clinical point of view, and saying, what can we do to improve outcomes? And that's what GIRFT has given us. So we'll be taking some examples which are of interest, because the GIRFT programme, as you know, covered a wide area. So when we would do a visit, we could find out things that weren't quite right. And the advantage then is having the management team in the room to say, well, why aren't we doing this? And to put that challenge back. So what the national report does is highlight some of those positive things, but I'm very lucky in the sense that I've got a repository of how people have fixed it. So in some of the difficult questions, the wicked problems, I will try and produce some solutions, some of which are in the report, some of which sit in my head, but that will be what's the problem, because for every problem, there's a solution. And it's not always easy and obvious, but having that external view can sometimes facilitate finding it.
And thank you so much, Martin. And we look forward to hearing from you at the Collaborative.